Hello, how are you doing? I'm Dr. Anthony Gonzalez, and we're here reporting from community newspapers. I want to thank community newspapers and Grant Miller for the invitation, allowing me to host this program. And so today I have my first guest on this show, and I've brought no one better than my beautiful wife to join us today. So we have Dorcas with us. Welcome, Dorcas.
Thank you. Thank you so much for having me. This is really definitely a privilege to be here, and thank you so much for choosing me.
Of course.
As your first.
Well, you chose me about 35 years ago, so I have to, of course, choose you now. So, but we're going to be talking to Dorcas, learn a little bit about Dorcas today, and then we're going to talk about two important topics that affect a lot of us in our community and, of course, throughout the U.S., and we're going to be talking about dental hygiene, and we're going to talk about special needs and autism in our community as well. So, Dorcas, why don't you start off and tell me a little bit about, and tell the audience about yourself.
Okay, so my name is Dorcas Gonzalez, and I was born in Cuba and in 1968, so there you go, I'm 52 years old. And of course, I came from Cuba when I was 11 years old. I was born in Holguín, which is the east side of Cuba. No, I'm not from Havana. So I'm very proud to be a Cuban, and I arrived here in 1980, and I was 11 years old. Since then, I've been here in Miami all my life.
So I remember, us, of course, when we were growing up, and you used to tell me the stories of you coming in 1980 through that Mariel boat lift. How was that?
It was definitely very traumatizing. There's no doubt about it. But it was, thank God, I always thank God for my parents that gave me that opportunity to come here to this country and have freedom, that we didn't have that in Cuba, and have so many other opportunities, like being able to have a career, to have a normal life, and enjoy this beautiful United States. And it was very dramatic in the sense that coming all the way from there, and I was 11. It was the coming in the ocean. It was midnight. It took us 12 hours to get here when it's only like 90 miles away. And it was just, it was very traumatizing, just very packed. He will take out people from the jails, a lot of delinquents,
criminals, and people with mental issues. I remember that as well.
Absolutely.
I heard that. Wow.
So, but we definitely.
You made it over.
We made it over. We got here, and here we are.
All
Thank
right.
God.
So you grew up in Miami. Where'd you go to high school?
I went to Hialeah High School, and I'm very proud to say that. And I had so many beautiful memories in that school, definitely. And one of fun times as being a high school student, of course. Once you get there, you think you know it all, of course. And meeting so many new friends, because some of them, they're coming from junior high, but other ones, you meet new people. So it was definitely very exciting.
So then you, of course, fell in love with dentistry. And I remember when we started dating, we met in high school. I didn't go to Hialeah High, but we met in those high school years, and we first met at church.
Yes, we did.
And you always talked to me about dentistry and how you love dentistry and you love the dental field. What turned you on, and why did you go into that career path?
Well, I remember, to tell you a little bit of when I started saying that I since I was 9 years old, I always told my mom that I wanted to be a dentist. The love for dentistry is definitely my passion. It's what I love to do. To me, going inside a dental office, it gives me life. Makes me feel like so important, so amazing. And I took all my prerequisites to go to dental school.
I remember that. Yeah.
And it's really, really about helping patients. As a dental hygienist, I went into dental hygiene instead because that was a decision that I made after, even though taking all the prerequisites. And there was no dental school here in Miami at that time. And I didn't want to leave. My parents were begging for me to leave, but I didn't want to go anywhere else. And I stayed, and that's when I go into dental hygiene. But I was a dental assistant when I started working with the dentist when I was 18 years old as a dental assistant, and they trained me on the job, and I loved it. I also went to the maxillofacial department at at Jackson Memorial Hospital, and I also did volunteer work there. And I learned so much, and I loved it. So I went into dental hygiene, and the love for me in dental hygiene is being able to help the patients with the oral conditions and really educate them and to have a better oral hygiene, because there's so many different health needs in the dental world, like gingivitis, periodontitis, and keeping it healthy. It connects with the entire body, because if you don't prevent that bleeding, and you don't control the amount of calculus, the amount of tartar, and you don't brush appropriately, and you don't do it correctly, then of course you can run into other medical issues as a heart attack, diabetes, and even Alzheimer's too.
Wow. So should you, you have to brush your teeth in the morning when you wake up because you got bad breath. How many times a day should you be brushing your teeth?
You should be brushing your teeth 3 times a day, or every time that you eat. You should always brush your teeth, use a soft toothbrush. Okay.
All right.
And make sure that you floss.
Yeah, I was going to ask you about flossing. I have to floss as well?
Yes, you do, because there's nothing that gets in between your teeth so amazingly like as a dental floss.
But nowadays they've changed the dental floss to these like little picks.
Well,
and
yes, they do. They have little picks.
Does that replace flossing?
Nothing replaces flossing.
Okay.
Especially when you have braces. Of course, if you're going to ortho treatment, obviously it's better to use a proxy brush. You have the floss threaders. And of course, an electric toothbrush, especially to those patients that were periodontally involved, I will immediately give them and, teach them that with an electric toothbrush, it will definitely be so much better.
So we have to floss every time we eat, 3 times a day. We have to brush our teeth. How often should we be seeing our dental hygienist?
Our dental hygienist, you should be seeing her every 6 months, unless there's a periodontal condition, of course. Then you'll see them every 3 months.
Yeah, because I have to see mine every 3 months. I must have a condition, huh?
You must have.
But I have all my teeth still. That's because of you.
Exactly.
All right. So you went through dental hygiene. You've helped many patients for many years in dental hygiene. And of course, we got married. We got married in 1993. On the last time I was here, Grant asked me what was my wedding anniversary? What was your birthday? I remembered all those. And we got married, and we had 3 kids. We have 3 boys. We have Michael, Alexander, and Joseph. Michael is 23 years old. Alexander is 19, right? 19? And we have Joseph, who's 17 years old. And so we learned, and before I go into your second career, because I think now Dorcas is in her like 3rd career now. I've been stuck on 1 career, but she's now in her 3rd career. Let's talk a little bit about the boys, and tell me a little bit about Michael, Alexander, and Joseph.
Well, Michael, as you said, he's 23. Yeah. Okay, 19 and 17. Well, the 3 of them are Fragile X. And Fragile X is a genetic condition that causes a range of developmental problems or intellectual disabilities, such as, cognitive impairment, learning disabilities, speech delay, ADD, ADHD. They could be either on the autism spectrum, or they could be actually have autism, and also anxiety, a lot of behavior problems. They could have 10% of them have seizures also. So the 3 of them are Fragile X. I think God chose us to be the parents of these 3 amazing kids, that even though they have the same diagnosis and the 3 of them are in the autism spectrum, each one of them has something special. And I always say that even though that they have a disability, a delay, an intellectual disability, but they're unique in their own way, and they're all different, even though they have a common denominator.
So Fragile X doesn't
diagnosed.
always come in the same form or fashion. You get different levels of Fragile X?
Absolutely.
All right.
They have different levels. They have different, there's like Michael is very outgoing. Michael is accomplished a lot because he went to the Life Panther program at FIU, and he was able to be there and take classes with everybody else if it was like an inclusion program. And of course, he had a lot of support of the program and coordinators, but he did a lot. And he used to go for 4 years. He went to FIU, and he was in the public transportation.
I remember he used to take a bus going over there to FIU every morning. Either you or I would drop him off at 6 in.the.morning at the bus stop, and that was incredible.
And his love is for music, and he took a lot of courses, like the study of the history of the Beatles and things like that. And he was even in the marching band of
That's
FIU.
right. I remember we used to go watch him in the football games.
Yeah,
We wouldn't watch FIU play football. We would watch Michael play in the marching band. So you have a lot of moms and dads who are listening to us out there. They have a young child who can't speak, who's acting peculiar, and everybody says, put them through speech therapy. What do you tell those parents out there? Do they need speech therapy? I've heard occupational therapy. What do they need?
I think the most important thing is not to be on denial. You as a parent could be the biggest obstacle for your son or your daughter not to be able to succeed, not to be able to get to the next level. And to me, that was the most important thing. We were not on denial. And immediately you ask for help. You need to ask for help. There's centers out there, like the Child Development Center that belongs to Baptist Health. And that's where we took our kids. And that to me is the key for them to succeed, for them to be able to speak, for them to be able to walk, be able to, for the part of the cognitive, be able to understand. And all the sensory with the occupational therapist, but just go, take them, ask for help. Don't be in denial, and you're going to see the difference in them. And some of them, they're going to succeed in one thing. They're going to be delayed in others, but just keep going, take them to therapies. And yes, there's a lot of help out there.
So sometimes we need, I remember, our kids needed everything from speech therapy, occupational therapy. Tell me about that. I've heard, remember our kids, like Alexander, our middle one who's 19, needed a lot of occupational therapy. He had problems eating. Today he has no problems eating.
He had apraxia, but because of course I'm a dental hygienist, I knew exactly also what to do and support him, not only with being able to receive the information from the therapist and going home and taking it and reinforcing all of what I was receiving at that moment. So I used to give him a lot of massage in his cheeks. I used to put a toothbrush because he will gag a lot. He couldn't chew. I would put a mirror. For him to imitate what I was doing with a cookie, I will chew on it. I will sit him on the high chair. I will chew on the cookie for him to see me, and also put a mirror in front of him. So all of that, you reinforcing everything that they tell you, even if you take them once a week, or ideal is minimum 3 times a week. But if you take them twice a week and every day you reinforce that of what the occupational therapist or the speech pathologist is telling you, you're going to see the progress is going to be a lot quicker. So
we have speech therapy some kids need occupational therapy. There's behavioral therapy as well.
Behavioral therapy,
applied
of course.
Behavioral, ABTs, applied
ABA,
behavioral,
yes,
ABAs.
you have.
And so what do they do for the kids?
For the behavior therapist, it's really just teaching them how to, it's different. It's like, how can I say?
Well, I remember we had a problem with Alexander, his reaction to...
Because he will get frustrated,
right?
right?
Or the way he would react to somebody else.
Right.
And so I remember that problem that
so
we had.
him reacting to someone else or something new, the unknown. So they get very frustrated. So what is it that you can do to replace that behavior with good behavior? So it's really replacing and getting to know the child in order to be able to fix the problem that they're having.
So what I've heard so far is don't be in denial. If there's a problem with your child,
Right.
get help early,
Absolutely,
right?
early.
Go to a center. We
Intervention.
talked about the Child Development Center. Any other resources in South Florida that we have used?
Absolutely.
Who's our other best friend in
Well,
South Florida?
The other best friend in South Florida will be the Medicaid Waiver.
Oh, of course. Yeah.
Absolutely. Medicaid Waiver is definitely something that parents need to reach out, that they need to ask, what are the benefits that they are entitled to receive through the Medicaid Waiver and the Medicaid. And that's going to be, because it's very costly. It costs a lot of money, but we have our government that helps and gives the support that they need. So that is very, 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 very important.
Yeah, one of the things I realized as a father and as the person who was dealing more on the insurance side was that having a diagnosis of autism, and some people want to be boxed into autism, some don't, but autism is very broad, and our children are Fragile X is their primary diagnosis and intellectual disability.
Right.
But if they fall into autism, you can get coverage in a lot of insurance plans.
Absolutely.
Right. So insurances can cover if you have autism. So we talked about the Child Development Center. We talked about Medicaid Waiver. We have Card. What about Card?
Oh my God!
We got to bring Michael Alessandri. Michael Alessandri. We got to bring him here.
The best of the best.
Tell me about
He is
Card.
compassionate. He's so passionate about what he does that his purpose is changing this kids' life, which it changes the parents' life, the family, the entire family. And at no cost, you go there, and he's always willing to help you. He sets up everything for you to be able to achieve the goals that you want with your child. And even if you cried, you're frustrated, and they have everything there. They have the speech pathologist, they have the occupational therapy, they have the behavior analyst, they have everything, and they do it with love because they care. And it's just, you can't go wrong with Card. You just cannot
That's
go
awesome.
wrong.
Yeah.
It's the best.
So what happens, and what we've noticed, and I thought that's why it would be important for us to bring to your attention everything about special needs, since we really have an expert, somebody who's lived through it. My beautiful wife here has lived through this with our three boys, and these kids grew up, right? So initially, they go through speech therapy, occupational therapy, behavioral therapy. They go to schools, and then they eventually finish, primary school and secondary school, and then you have to think about college, and that's where the Dan Marino Foundation rolls in as well. And Michael went to FIU's Panther Life program, which you talked about, and now it's called the Embrace program. And so these kids go through a secondary program now to try to help them get through their education and eventually get employed, because you may or may not know, but the employment rate of somebody with a disability is like 20%, 18%, 19%. So 80-90% of those with a disability are not employed. And so, of course, going through Panther Life. So now the Panther Life has become Embrace, but how was the Panther Life Embrace program for our son, for Michael? What are your memories?
My memories were the best memories, because it's all about teaching them how to be independent, because we're not going to be here. We're not going to last like forever and ever. So to me, that was the most important thing, is for them it's not so much knowing 2 + 2 or how much they're going to be able to read, but is, being able to have, to be independent and to be able to live on their own one day. and have a normal life, quote unquote, as every other teenager, young adult have, just like you and I. So that was, to me, seeing him being so independent and following all the, how they learn how to have time management. They learn how to time management. They have also their they
teach them how to do interviews
work,
and so
interviews, how to interview. They prepare them to interview for different jobs, and I cannot find the correct terminology of when he used to have the jobs and they used to train him. Like he worked in hospitality. He worked in on the radio also, like, you know, just getting the cables, getting everything ready, and just being there and socializing with all kids his age, and learning how to be independent, especially the time that he was able on the summer residential program when he stayed for 4 weeks, and how they learned management. They used to live there.
They learn how to cook.
They learn how to cook.
And clean.
Yes. It was amazing. That, to me, that was...
We got to have them cook and clean a little bit more often.
At the house.
At the house, right. Yeah, I think so.
It will happen. It will happen.
All right, so now they finished secondary school, they finished this college program, and now they have to become employed. And now another resource that's available in our community is the Moya Foundation, which you're very involved in the Moya Foundation as a board member. And thank you to Lily and Alvaro de Moya. And thank you to Alex de Moya as well, that they've created this foundation. So what you're seeing is the pattern is kids are growing up into adults. We're trying to prepare them. We're trying to educate them to the best of their ability. And then we're trying to get them employed. And the problem with employment is that the difficulty of it, getting them employed and maintaining employment. But the Moya Foundation helps with that, right?
Yeah.
So what is it?
Exactly what we do. The Moya Foundation is a nonprofit organization, okay, that is committed. What we do is that we create the employment for employment opportunities for the young adults with unique abilities. That is exactly what we do, and we live by that. And we give them all the support so they can maintain their job. And that's when we have the life coaches, we have the behavioral, we have the psychologists for any emotional. So we give a sensitive training to the employers. We partner up with them, and we give a sensitive training to the employer, and to the and we give the support that the employee needs. So we just don't throw them in there, for example, in a hotel. So what we do is that we connect them with one of the life coaches that we have, and the life coach goes there and guides them step by step until they feel more comfortable, and little by little they let go. But we are always going to be available, because all we want is for them to succeed and to be independent, to have a job, and to maintain it. So that is exactly what we do. And as a matter of fact, maybe you're going to talk about it, about the watch party that
we have a special event. We have a special event this weekend?
Yes, we do.
What's the special event this weekend?
The special event this weekend is Resilient. It's going to be the Moya Foundation virtual gathering, which is going to be October 10th, this Saturday, coming up at 7 p.m. So you can register there. You can donate there. They give you all the instructions. So once you go to the Moya Foundation virtual gathering, you are going to see it, and you'll be able to be part of it. You're going to see amazing things, all these kids doing different shows with their strengths, with their talents. So it's going to be spectacular, so you cannot miss it. October 10th at 7 p.m., the foundation, the Moya Foundation gathering, virtual gathering.
Yeah, so I mean, I remember how supportive the Moya Foundation was for Michael when Michael got his first job. at a hotel,
Yes.
and they were there with the struggles that he had. They were there to support Michael. They were there to support the employer,
Yes.
the hotel chain, and
Yes.
because for some employers, whether if you're an employer out there that you can employ a young adult with a special ability or a unique ability, then reach out to the Moya Foundation, and they'll educate you, and they'll embrace the opportunity, and they'll support you. And if you're not, and you just want to support, then support us on Saturday. This Saturday, October 10th, will be the Moya Foundation virtual gathering. And I think it's on Facebook, it's on YouTube, it'll be all over. So
Yes.
now in this new COVID era, there's no more gathering together in big galas of thousands of people. Now we're doing this stuff virtually.
Yes.
So what does the future hold for people with special abilities? What do you think is going to happen now in the future?
I think there's always a hope for each one of them. And as parents, if we support them, and if we have like all this support, like UM card, the speech pathologist, all of that, I think they're gonna be amazing. They're gonna be successful. It's gonna be definitely something that is gonna make, they are able to make a change in so many other people's life, and they can be successful because we all have strengths and we all have weaknesses, and you might not be good in one thing, but if you're good in another, so you're gonna succeed. And that's exactly where we are taking them little by little. And so if you're a parent of a kid with special needs, just have absolutely trust in God, trust in yourself, give them the inspiration, give them the motivation that it will happen. It's going to happen, and it's different stages. Is it easy? No, it's not. But just keep trusting in them, breathe them life, breathe them believe that yes, they are going to be someone in this world in the future.
When you say that, it brings to my memory of a young woman who I think reached out to you from Ohio because you had you did prior to the COVID era, Dorcas spoke at a women's conference of 4,000 women, and that made it through the internet and social media. And a woman in Ohio had told you she was on the brink of committing suicide with her child, I guess a homicide-suicide combination, and you were able to help her. So reach out to Dorcas. She's available for everyone and anyone to help give a hand, whether it's just a prayer, whether it's just some advice, and help you along the rocky road. But yes, there's going to be some ups, there's going to be some downs, and we've seen it in our family.
Absolutely.
And yes, everybody has a unique ability, and some people have strengths and some people have weaknesses. I was happy to find out that my weakness in high school was baseball. So since I realized I was never going to be a baseball player, I decided to do something else, and then I became a surgeon. But yeah, you're right. You'll have to find the area in your niche that's perfect. So I want to thank Dorcas for being with us here today. I've learned that I have to brush 3 times a day. I have to floss all the time. I do see my dentist every 3 months, so that's good. And of course, reach out to your local community resources for those special kids that you may have, or those special adults. And anything you guys need, reach out to us. We're here to serve our community and help you as well. So Thank you, Dorcas. Thank you for being here with me on my first show.
Thank you for having me on your first show. Thank you, thank you, thank you. And I hope I'm sure we made a difference today in a lot of people's lives.
I'm sure, yes. I think we will continue. And I want to thank community newspapers, Miami Community Newspapers, and I want to thank Grant Miller as well for the invitation. And I want to wish everybody a beautiful day.